Hi, everyone. This is Jody Hanson. I'm hoping you can hear me. I'm not able to start my video at the moment. We're working on some technical difficulties, but thank you for being here. And again, hopefully you can hear me. I'm getting a head nod, so I hear that you can. With me today are Dr. Sami Ariola, Director of Johnson County Department of Health and Environment. We also have Elizabeth Holshoe, who is the Director of Epidemiology, and Allison is our ASL interpreter. Thanks for being here as well. Dr. Ariola, why don't you go ahead, if you don't mind, please, and just give us an update on what is new with our vaccination rollout.
Thank you, Jody, and happy Friday, everyone. Our clinic ran pretty well today. We again vaccinated about 1,400 people today in our 80+ group, getting their second doses. So that's really good. And there's been a lot of questions about our 80+ group. So I've got some good news, I hope, in that regard. Here's our plan for next week. Our vaccination in our 80+ group for second doses continue on Tuesday and Wednesday next week. Remember that those on Wednesday, most of those on Wednesday are people that we rescheduled from last week Tuesday, that we canceled the appointment because of weather. Now for next week, Thursday, we had opened up appointments earlier this week for additional 80+ persons to get their first doses. We are adding additional appointments to that Thursday, 300 additional appointments. We're opening up 1,400 appointments for Friday. And the following week, March 2nd, for the Tuesday, we're opening up an additional 1,400 appointments for a total of additional 3,100 spots to vaccinate in our 80+ group. So a few minutes ago, we had sent out the link for the appointment directly to 80+ residents who qualify, who are on our list. We've also sent appointments for those that are due their second doses. And so we ask that you book those appointments. Right now, everyone that's on our list, that's 80+, should have received an email from us. And I just heard that we have our staff on the phone assisting people to book appointments. So if you have questions, again, either you email us, jcdhe@jocogov.org, or you call us 913-715-2819. Our staff are there assisting people to book. Now, there are two groups of people that should not worry, that we're working on. If you had reached out to us that you need assistance with transportation, we're working on that. If you are one of the people that we need to bring vaccination into your home, to bring vaccination to you, we're working on that. But for all other persons that are 80 or older in the county, you should have received either a phone call or an email, depending on what you provided to us when you completed the online vaccine interest form, and the appointments are there. So if that fills up, then we're going to see if we can open up additional appointments. But we think, based on the numbers that we have and the response to the last one, that we should be able to reach most of those that have indicated interest in the vaccine. Again, those are open. They opened a few minutes ago. They are strictly for those that are 80+ that are getting either first dose or second dose. Thank you.
So I'm curious as to why we were able to open up these slots. Did you get more vaccines, or what was the rationale for being able to open these?
Yeah, so what we opened up are the vaccines that we have at hand. Our vaccine that should be here this week to inform what we do next week are not quite here yet. So we're working on that. And so once that is here, that's why we can really only open up appointments until Tuesday. So again, next week, to be clear, all the vaccines that we need for second doses are here. So the the appointment for Tuesdays and Wednesdays are largely for second doses. Those are here. The ones that we're waiting to have are the additional ones that we need beyond what we have announced. And so up until yesterday, we had enough to open up 1,100 until Thursday. Okay, and so as we get additional vaccine, then we open up more appointments.
Elizabeth, how are things going with vaccinations for educators and childcare? You're always great at giving those updates. Anything new to report today?
Yeah, so we are currently finishing up our second public school clinic this week, and we are doing that at one of the Blue Valley campus buildings that's currently empty, so we're very excited. This week we will have immunized a little over 2,300 public school staff, and today we just sent out invites for a clinic next Saturday for our private parochial schools and our childcare providers. And again, just working through that list. So after today, we will have completed about 37% of our public school staff. And as of next week, we should be close to 40% for both our private parochial and our public school and our childcare providers. And with the governor's new announcement this week that we'll be getting 2 trays allocated strictly for K through 12 educators, that means we're actually going to be able to move through that group a lot quicker than we had originally planned. Originally, we were thinking we wouldn't be done immunizing all of these groups, the K through 12 public schools, private schools, and childcare providers until early April. But now it looks like we may be able to finish up and be wrapping up towards the end of March, which is very exciting. And that will be very helpful because that means we won't have to be taking doses of vaccine that we could be using for 80 plus or for our 65 and up and trying to push them over into our K through 12 schools. It just gives us a little more flexibility to really be able to get through both priority groups in phase 2 tier 1 much quicker than we would have been able to do without that.
And Jody, let me further clarify my answer to your question. So to be clear, the reason we are opening up the appointments for next week, Friday, and the following Tuesday is the expectation that our doses shipment that are delayed this week will be here early next week. So that need to be clear. So we don't really have that at hand yet, but we know the weather is improving and we expect that to be here early next week.
So that's for people 80 plus. The ones that you're adding are next Friday, and then the following
Tuesday, yes. And then additional appointments on Thursday. We had only done 1,100 because that's what we had at hand. But we expect this to be here early next week, early enough for the Thursday clinic as well as the Friday clinic.
Okay, that sounds good. So we were talking about education before. We have a question from somebody that says, I teach at JCCC and do go into Olathe Head Start as well as teach in a private religious school setting. How do I get a vaccination?
Well, so we've had a ton of questions from college professors and workers in college. And I know that they've reached out to KDHE as to where they fit in. And my last, Elizabeth can jump in if I don't have up-to-date information, but my last update and my message to them has been, you will qualify. If you are not specifically called out in the phases in the plan, you will qualify based on age. And so they are not part of this vaccination. It's K through 12 as well as childcare. And they will likely qualify in phase 3 if some of them, if they have existing conditions that allow them to, but most others will be phase 4 and phase 5.
I will say for this individual, and Dr. Ariel is absolutely right, if you are a college professor, at this time you do not qualify within phase 2 for vaccination, so you would fall where your age and risk category is. However, you are interacting and you're in school buildings and you're, teaching or something like that, my recommendation would be to talk to the administrators of those programs, the Head Start or the private schools. We are including substitutes sort of at the end of our vaccination clinic. So we're getting through the core staff and then we'll get subs in. And so they may be willing to include them in their counts if they feel that they are interacting with children and pose a risk. And so that would be the way to do that, is to reach out to those administrators. But again, at this moment in time, I know we've also had a lot of questions about teachers who live in Kansas and work in Missouri. Because we are strictly going through the licensed childcare providers and our K through 12 administrators, for these current vaccines, we do hope to open them up for additional teachers as we continue to move through this phase. So for right now, just those who are associated with the Johnson County schools and daycares.
Okay. I've seen a lot of questions about Moderna second doses, and there's one here on Facebook, someone that said they're on day 28 after their first Moderna vaccine, and they're now due for the second and haven't received an email yet. When will they be able to get their second vaccine, or when will they expect to get a notification?
Yeah, I was actually just talking with staff about that. We're working on that, and I think we've walked in a few Moderna second doses this week, as well as trying to do that next week. But we're working on that, and 28 days. Again, like we said, 28 days is the exact date. But like you said, you can wait until 42 days. That's the current CDC recommendation. But actually, Europe, UK, they actually do it a lot longer. And there are, really there is evidence out there that waiting longer, number one, does no harm. Number two, actually may give you even better immunity. So you are fine. Just wait to hear from us, and you have time to get your second dose. There's no need to panic. I would say that even if you go beyond the 42 days, you're still fine. You just get the second dose as soon as you can.
Okay. Someone is asking that they've got an 84-year-old father who has taken the survey, but has not been contacted. So it could be a situation where you just recently as the past maybe last few hours reached out to people. So if somebody is 80 plus or knows someone that's 80 plus and they haven't heard from you maybe by the end of the day and taken a survey, what should they do?
You should call us, or you should call our number or email us. Right now, just about 10-15 minutes before this call, those appointments opened up, and the messages went to everyone that is remaining on our list. I would say that the data, Elizabeth can speak to that, the data is not, there are challenges with the data. Sometimes the emails and phone numbers are not entered accurately. So if you have not received an email and you check your junk mail folder and it's not there, and your dad is on the list, call. We have people online right now assisting with booking an appointment. We do want to get all of our 80 plus persons, residents, an appointment. And that's why we opened up all these appointments strictly for 80 plus. Now is the time to do that.
I will also say, I know some individuals filled out the form for maybe both of their parents, right? And put their email address in there. You will only receive one email, even if your email address is in there multiple times, but you can use that link to sign up both of your parents, for instance, or your neighbors that you're trying to help out. As long as they are over 80 years old, they are eligible. So even if you receive one email, but you maybe signed up to helping out two individuals, that's okay. You can go ahead and use that for both.
We had a question asking about COVID vaccine side effects. They read somewhere that maybe you can get a bad rash from a COVID vaccine. Someone is talking about their specific allergies. So what would you say to that person?
Well, so there are possible side effects and allergic reactions, anaphylaxis, all of those are possible. Mostly in people with a history of allergic reactions. But I'll tell you, data updates from Centers for Disease Control and Prevention as at, I believe, January 18th. At that time, just under 10 million doses of Pfizer vaccine have been given. and just under 8 million doses of Moderna has been given. Total reported allergic reaction was 64, 47 of them in Pfizer, 19 in Moderna. So that 47 really accounted for 4.7 in 1 million in every million that's administered. So that's not a whole lot. For Moderna, it's 2.5 for every million that's administered. So it does happen. That's part of why you are asked to wait for about 15 minutes to be observed. But again, it could occur even after the 15 minutes. It happens, not very common. There are also other side effects that are there, joint pain, mild fever. When I had my second dose, I had chills. But those things are transient and they resolve very, very quickly. And in many cases, there are really signs that the vaccine is doing what it's meant to do. It's your body responding to that.
Yeah, I will say some of our team did have a rash. I had about a week after my injection on my second dose, I had about 3 little bumps on my injection site that were very itchy. And it was very odd. I'd never gotten anything like that, but it resolved. There are a number of sort of these immune response side effects that can occur. Of course, if you're concerned, please reach out to your physician. If you have a specific allergy that you're concerned about, please reach out to your physician. Our staff on our call center are not licensed to provide any kind of guidance about your specific medical condition. So the best way that you can do that is either call a nurse line or reach out to your primary care provider and ask for specific guidance for your own health.
Someone was asking, this is kind of going back to the educator and childcare discussion, in what group can religious childcare workers, so maybe that someone provides childcare during a religious service?
So again, at this time, because it is licensed childcare providers, we are going through those who have registered with the Kansas Department of Health and Environment and the Johnson County Department of Health and Environment. For instance, if it's a preschool that's associated with a religious school, those individuals are included. But for say like a Sunday school teacher, just in that hour long, they at this time are not eligible through our current phase.
And then this is kind of a similar question, just another question about when am I eligible? So maybe someone that provides care to elderly people, when could that, not the elderly person, but the person that cares for them? Is there a certain spot for people in that profession?
So we're trying to resolve that, as you can tell. That's complicated, and we're trying to resolve and iron that out. Right now, they're not part of the group that we are vaccinating, but we're looking into that, and I know that KDH is looking into that also.
Okay, so the message there, just keep watching, and as we get news, we'll share it here, we'll share it on the web, our newsletter, all the places we can. We have a question from someone who's a healthcare worker that missed the sign up for phase 1, and they made the comment that the survey that's out there does not have a place to mark healthcare worker. So what should a healthcare worker, phase 1 person, do if they need a vaccination?
First of all, Elizabeth, did we know there's no healthcare worker is not included on that page?
No, because they were not part of phase 2. So we've been discussing doing a phase 1 roundup survey for healthcare workers, for instance, who we missed. So stay tuned. We know that there are a number of individuals. You can also email jcdhe@jocogov.org. We're keeping a list of those individuals who have reached out to us. And for instance, for some of our spots that we have opened up for next week, we have been reaching out to those individuals. So if you're a healthcare worker, we definitely want to get you immunized. So reach out and we will be in touch.
All right, and we're just getting other questions about different professions. Somebody that works in the traveling construction industry, somebody that works in food processing plants. Any idea when we think different jobs like that will be starting with vaccinations?
Food processing is included in phase 2. Right now, our focus is on 65 plus and educators and childcare, and making projections into as to when will be done and move to other phases is difficult because we are hoping that the supply gets better But if it is going at the current pace, it will be a while. But we are hoping that the supply gets better and we're quickly able to move through this group. But if you are in a food processing plant, you're in phase 2. I don't remember the other 2 that you mentioned, but if your industry is not called out per se, then you qualify based on age.
So if you're in one of those categories, the individual who works in a food processing plant or any of these other phase 2 priority occupations or sectors, please go on and fill out our phase 2 interest survey. It's got that information in there where you can click which sector you're in. And that will help us as we complete our 65 and up and continue to move into these other sectors. That way we have your information and can go ahead and let you know when we have vaccine available for you.
Do you anticipate once we get into different phases, phase 3, phase 4, will there be a phase 3 interest survey and a phase 4 interest survey? Have you talked about that yet?
There will be a phase 3 interest survey, and that should be coming out very soon also.
Yeah, my team has, sorry, Dr. Ariola.
I know, I'll let you talk. I know you're already working on that. You talk about, I want to emphasize that 65 plus and child care educators is by far our largest group. Combined, I estimate could be in excess of 120,000 people. But once we're out of this large group, we'll move through the other groups fairly quicker because they are smaller. But talk about what you're working on, Elizabeth, for phase 3.
Yeah, absolutely. We know that everybody is very anxious to sort of be able to express their interest in getting the vaccine. I know everybody wants it, which is excellent. So we are developing a phase 3, phase 4, phase 5 survey so that we can capture all of those individuals. Pretty complicated because the way KDHE has separated out phase 3 and phase 4 are various pre-existing conditions. And so we're trying to figure out the best way to really address that in a survey. It's certainly not something we can vet or ask for proof of. So trying to just to sort out some of these issues and learn our lessons from our first round of survey where we, crashed the server on the first weekend. So, but we're definitely interested in understanding who's interested in getting the vaccine, understanding what that looks like in terms of number of doses. And hopefully too, once we get beyond these 65 and up and K through 12 and childcare providers, there will hopefully also be more vaccine, which will also allow us to move through these additional phases more quickly than we've been able to get through this very large phase, as Dr. Ariola said.
Okay, well, it seems like our questions have kind of come down a little bit. I would just ask maybe just one more time, sort of wrap up what we can expect next week and any closing thoughts.
Right, so I'll let Elizabeth talk about the plans again for vaccinating and educators and childcare next week. But next week, it's all about our 80 plus, second doses and first dose. The second doses are largely planned for Tuesday and Wednesday, Thursday and Friday, as well as the next week's Tuesdays is those that are yet to receive their first doses. So that's our plan next couple of weeks until we get to a point where we feel comfortable that we've moved through most of the 80 plus, which we think if we don't do that by the Tuesday next week, we will open up additional appointments to make sure that we do that. And so, now is the time to go and register and book an appointment and let us know if you have not completed the online survey, go and complete that. Our focus is going through and vaccinating all of our 80 plus groups in the next couple of weeks. Again, the key point is availability of vaccine, but we're doing our best to redirect vaccine to this effort for this next couple of weeks.
Yeah, and in addition to hopefully getting through our 80 plus in the next couple of weeks, we'll be continuing our childcare provider in our K through 12 public and private schools. On the 27th, next Saturday, we have a childcare provider and private parochial school clinic where we'll vaccinate over 1,100 individuals. And then the following week, we have planned another 2 clinics for our public schools to vaccinate over 2,300 of those staff. Obviously, it's a much larger pool in our public schools than private and childcare. So just getting as many vaccinations into arms as possible, protect our schools, protect our childcare centers, keep them open, and let's see what we can do.
Thanks. I might just try to pick up a couple more questions that I'm seeing that we might have missed. One of them was about, will Kansas consider combined T2 and T1 diabetes into phase 3? Both should not be separated.
I'm sorry, that's talking about phase 3 or phase 4. Like Elizabeth said, we are trying to tease out what is quote unquote serious or critical medical condition from quote unquote less serious. And so we will try our best to make that as clear as we can. And so we will do that. And if after we bring that out, if you have questions, we'll be very happy to address them.
I will also follow up on that just to say that those are Kansas decisions, that they have laid out the medical conditions, which I think this individual was referencing. We have been laid out a fairly strict sort of pool of individuals in each of the big phases, and then we can prioritize within those. And so really that's a KDHE decision as to where type 1 versus type 2 diabetes falls. And so that's a little bit out of our control.
Okay, and then maybe one more question. Residents of group homes that have an intellectual developmental disability,
they're in phase 2. I just was having a lot of conversation about that with JCDS Director Chad today, as well as other members, other stakeholders in that industry. And we have finalized, we have an idea of how many doses we need. They are working with a group that's going to effect the vaccination, and just really looking for right now we have them grouped in tier 2, but quite candidly, you can make a case for them much earlier, even partly in phase 1. So we're working on that. Again, the key basic thing is availability of vaccine, but that's very, very, very high on our list. And we're going to deal with it as we deal with the independent living and provide vaccines as quickly as we can to that group.
Okay, well, thank you so much, Dr. Ariola. Great information. Thank you so much, Elizabeth. Thank you, Allison, for being our ASL interpreter. Thanks to those who are watching on Facebook. The questions that we didn't get to yet, we will do our best to get to them in writing either today or into the weekend. So hopefully you guys have a great weekend, and thanks so much for watching. Take care.